Hello there, Southern Pacific Community Education Series tonight. Thank you for having me. My name is Michael Rains, but as you see there, I go by Seaweed. So if you hear that name, that's who they are referring to. That was a name that was given to me by a kid a long time ago when I was a school bus driver. And it's just hung on, and so you can call me either Michael or Seaweed. And I'm representing the Elevate East County Coalition, which is a group that I'll tell you more about as we go here. But I want to point out just a couple things here. There's a contact email for me if you'd like to get in touch to ask any questions about prevention generally, or the coalition, or how to get involved. But I also want to point out the logos at the bottom. This has been a partnership between Healthcare Authority, which is funded from SAMHSA federal dollars, and then state redirected to programs that do prevention intervention work. And it started in 2021 as a partnership with Summit Pacific was involved in the formation, and also Elma School District. And since 2021, the coalition has been doing different activities in the Elma-McCleary area with the intent of decreasing the amount of substance use that kids are engaged in, and just generally preparing the town to respond to emerging drug threats. And so there you see our coalition logo, Washington Healthcare Authority, and the school district. And then finally, I'm an employee of ESD 113, one of 9 different educational service districts in the state. And so ESD 113 oversees 5 counties, and Grace Harbor is one of those. So that's how we found ourselves here. ESD is the fiscal agent for our coalition. So this is basically the bylaw for our coalition. These are our mission and vision statements, so you have an idea of what it is that we're trying to accomplish here. Elevate East County is a group of parents and also providers, students, teachers, and just community members in general who are interested in focusing on the protective factors, increasing protective factors for youth, and decreasing the risk factors for youth in regards to substance use and other potentially problematic behaviors. The mission is to empower the community with the knowledge and resources to build a brighter tomorrow for youth. And our vision is that we will have resilient youth who will choose to rise above using, they will choose to rise above using alcohol and other drugs and make healthier choices for themselves and for future generations. The thing I want to point out here is basically that our mission is to increase knowledge, to provide resources, but also just to build some capacity within the community to address things. We're talking about substance youth and the threats that youth are facing, and that is an ever-changing problem. It's something that we know is going to change in the future. We think we have a handle on something and something new comes along, either a substance or a way that kids have access to it. And so the community generally needs to be prepared to address that. There at the bottom, you'll see a Facebook page for Elevate East County. It is facebook.com/Elevate East County. And that's a place to stay updated on events that we're holding, meetings, and other opportunities for training. And then finally, there's an email address, elevateeastcounty@esd113.org. Feel free to always contact us through there. So the idea of what we are doing is prevention. We are trying to get ahead of something before it's a problem that is very costly and widespread. If you can address a problem at its root, you stand a chance of avoiding some of those more costly solutions to people being in substance use. There's a famous story about upstream, and that applies to a lot of different things. It definitely applies to prevention work, where people in the story saw people falling into a stream, or what they saw were people floating down the stream and struggling, asking for help. And some people responded by helping those people out, and were able to help a few people that way. And then others recognized that there were people upstream who were falling off of a bridge that was in disrepair. And so that is essentially the idea, is that those folks thought, if we can prevent the problem before it happens, we can head off some of these downstream consequences, we can treat more people early, and decrease the number of people that are winding up in treatment programs. There are a few ways to to do prevention work, and they're in this first point here. Root causes such as family connectedness and the community norms, what people think is acceptable behavior. Public policy, so what kind of policies a school district or a city or a county or even a state have that will ensure some safety for kids around substance use or lack thereof. And then just, once again, that general community readiness. The more information that we can get out to people in the community, the more people are aware of what is the problem that we are working on together and what to look out for, how to have successful communication with their kids, with other people in their lives. The idea being here that this positively affects a whole community or a whole age group instead of individuals who are already in crisis. If we can strengthen those protective factors, other negative outcomes that are not substance use, such as violence, depression, academic failure, can be reduced, and that's been shown to be the case. So just by focusing on the risk factors that exist already in the community and minimizing those and increasing the things that are protective to children, you can actually affect other things besides substance use negative outcomes. So we're talking about adolescence. This is the time when kids are exploring the world and making choices that can have really long-term consequences. It's a critical period because it's a rapid time of growth psychologically and development physically, and it makes kids particularly vulnerable to substance use and those consequences. There are legal ages for the use of certain things. 21 is the legal drinking age, but it's known that human brains continue developing until about 26 years old. A lot of that frontal cortex sort of development of thinking, decision-making, executive functions, those things are still developing, and the use of different substances, especially in excess, can limit the ability to develop those kind of skills. This type of prevention work has been evaluated in the state, in the country, around the world, and has been shown to have real significant impacts in preventing substance use. So for one data point I'd like to share is that from 2016 to 2023, communities that started and maintained coalitions like Elevates County, which is a CPWI community, showed that there were 70% improvement of family and community risk factors. So a 70% improvement in 70% of identified family and community risk factors. They showed decreases in 10th grade substance use outcomes as well in that time period. And the reduction statewide is alcohol use reduction, about 80% of those favorable outcomes. Cigarette use was down 49% in that time period, marijuana use down 11%. And that's all, once again, within CPWI communities. I should probably say that CPWI is the umbrella of the type of work we're doing, and that stands for Community Prevention and Wellness Initiative. Other positive results that were shown in that same time period was almost 100%, 95% of these CPWI programs showed results in delaying first use of alcohol and other drugs, in reducing use, decreasing risk factors, and increasing protective factors. So this is a project that's been happening in Washington State since 2011. It's based on a few different models. One that I know about is called the Icelandic prevention model. And these kind of prevention models are intended to be not top-down efforts. They are intended to be community organizing. And so if you can get more people engaged in the work of prevention, then you are building long-term resilience, especially when a program may no longer be funded. So if you have a top-down approach, state funding can go away. But if you build up the community's ability to respond and understand what's going on in their town, that can be long-term work that goes on regardless of funding. So in 2011, Healthcare Authority launched CPWI. Communities that care is another model that it's based upon, and it uses something called the Strategic Prevention Framework, which is used in a few different ways. You may have seen it in business models, and I'll show you the Strategic Prevention Framework in just a moment. But I also just want to say that Communities That Care is a program out of University of Washington, and it also is the source for a couple of the parenting workshops that our coalition offers in the community that I can tell you more about later. So since 2011, the program has really grown. There are now over 100 communities that are have active CPWI coalitions, and they are in all counties in the state and in 9 ESD districts. It is a community and school-based model. Once again, the idea is not to come in and set up a clinic, but rather to set up a coalition and a connection with the school so that you have people that are in the town outside of the school, aware and doing the work, and you have kids that have ways to engage in prevention inside the school. And the goal here is to build healthy and safe community environments, expand preventive services, empower people to make healthy choices, and eliminate health disparities. Those are things that we consider in the coalition as we make choices about what kind of programs we're going to be offering. I can tell you more about those as we go as well. There you have it. Community and school-based model, which is data-informed and is makes decisions at the community level. The goal being to determine what the root problems are, the root causes, and then to predict problem behaviors. So for us to be a coalition, to be funded to do this work, we have a few things that we are required to do, and all of these are essential to having a successful program. So for starters, we need to have representation across the community. And so you could think of maybe 20 different elements of a town, or sort of people that are engaged in the town in different ways. And we would like to get about 8 of those represented in our coalition. And so I think a lot about, I would like to have kids involved in a coalition. I want to know what kids are seeing and what they think they need. I would love to have parents involved in a coalition because they are the ones right there on the front line. School employees, teachers, the folks that work for the school are frontline and really need to be part of this work. Healthcare providers are very important to the work and are quite often the ones that are most commonly in coalitions because they already are doing that work and they're sort of called to it. Law enforcement, city officials, city and county officials, folks that can make decisions or that know what is going on, have a little bit deeper insight into what's going on in the community are really important to a coalition. And so that's something that is a requirement of our coalition that I'm always thinking about. How do we get people from other sectors into the coalition? So our coalition meets once a month and we get generally about 8 or fewer representatives from those sectors there. So we're always kind of on that edge of compliance, but it's a goal to continue working on. We're asked to allow the local decision making instead of being top down once again. We have to maintain an in-the-school presence that does prevention and intervention work with students. It's prevention education and also prevention groups, so groups of students that are doing work that that will sort of help lead their peers to healthy choices. We do direct services such as parenting workshops, parenting classes, and delivery of different education. The next one says environmental strategy, and that refers to any of the work that we do that attempts to change a long-term policy in a town, in a school, something that is, there's some potential to have a positive impact if we can make a change to a policy. I can show you a couple of examples of that later too. Public awareness campaigns, so advertising that we do on the radio and internet. And then finally, just participating, being part of the state and local evaluations. And there are a few different ones that happen. Hey,
Yeah.
a few different ones that happen in the course of the year. One of them is called the Healthy Youth Survey, which you may have heard about, which happens in the schools. It's a really important survey that students take. And another one that the coalition runs called the Community Survey. We do that every 2 years to see what issues people are feeling most concerned about, and also to evaluate how the coalition is doing, if we're making progress. So that's essentially what a community coalition like ours is asked and does do. And now let's go a little deeper. Here is what I was referring to earlier. This is, once again, something that you may have seen in use in business or other contexts, and it's the strategic prevention framework in this case. It looks like an arrow, but it really is more of a circle. This is a process that continues to repeat, and it's assessment of what the, not only problems in a community, but also what resources are already available. So we assess things like substance use rates, incarceration rates, school performance. We assess those kind of things, which might indicate problems, but we also assess what agencies are already active in a community, what kind of programs are there for kids and families, what is either not being tapped or we can partner with. So that's the assessment phase. Planning phase is based on that, and so we're moving from there to, okay, now we've looked at the town, we've looked at what resources and needs the town has, and we start to plan what we think, based on the context of the CPWI program, what we think will be effective in that setting. And so we're planning in a few different directions. There are direct services, but there are other ways to get a message out. After planning, we go into the implementation phase, and we're usually working on a 2-year cycle of this kind of implementation, and we are about halfway through that cycle right now. And that means that we are running the programs that we decided as a coalition are going to be effective in this particular community. Once again, that's the idea of this community coalition, is there are local decisions made about what kind of programs we offer. And then after that, we are evaluating what the programs that we offered and how they succeeded or did not, what people are still asking for. I would say it does go back to assessment, but I think these kind of loop, each project kind of loops individually as well. We recently had a town hall, and at our very next coalition meeting, we evaluated the success of that event and talked about what the next one should look like. So they happen in small cycles and large cycles too. So I've been mentioning this, risk and protective factors is a concept that is really important to the work of prevention and other kinds of social protection, social awareness work. The idea being that if you can identify what risk factors exist, you stand a better chance of minimizing those. And if you can identify what protective factors do or don't exist, then you can get to those. So the risk factors that we're talking about are not just personal choices, which I think people normally think of, that people are making bad choices to use substances. They're characteristics of a community called social determinants of health that include basically like the people that live in a community, the psychology of a community, what the family and community makeup is, what the cultural makeup is of a community. Some of those things are going to, like it says, be risks. They're going to engender risk for children and their choices. Protective factors do also include this sort of individual level, and they kind of look at the same domains there, so individual, family, and community. But the idea here is that these are the things that would create a less likelihood of problem outcomes. Substance use, once again, is the main thing that our coalition is focused on, but we know that if we're working on that issue, we're having positive impacts on other related consequences for kids. So once again, it's the local conditions that will determine this. We can look at our community in comparison to other communities, maybe of the same size would be helpful. but we still have to make decisions based on what the specific needs of this Elma McCleary area is. So I thought I would give you just a few general statistics about what's been going on in Grays Harbor. The coalition has access to more specific local data, but I can't share that publicly. It can be shared within the context of the coalition. So if you're very interested in that and you're at a coalition meeting, I can share that with you. But in Grays Harbor, you can see some indicators here of things that are not substance use necessarily, but could be related and definitely would pertain to the risk and protective factors that I was just talking about. And so here we're looking at statistics from the 2023 Healthy Youth Survey that students took. This is an anonymous survey that happens every 2 years in schools for 6th through 12th graders. And so we have stats here for 8th, 10th, and 12th graders and their perception, their reporting of depressive or anxious feelings or not being able to control worry. So those are the 3 bars there. On the left is 8th grade. 41% of 8th graders saying that they felt depressive feelings. And I do believe that's within the last 30 days is the statistic. When you get to anxious behaviors, the next one that is higher, 62%, and 50% of 8th graders reported that they could not control their feeling of worry. And then you can just see that I think it's comparable for all 3 grades. Sometimes these things show real distinct differences. The only notable one there to me is that 12th graders had more of an awareness that they could not control the feeling of worry. This is very important to know what kids are saying about suicidal feelings and actions. And so here's 8th, 10th, and 12th graders who report. The first bar is considered suicide, the second bar made a plan, and the third bar is attempted suicide. And those are all statistics in the 20% and lower range, and yet the considering suicide rate for 8th graders is 21%, 19% for 10th graders. So 1/5 of kids are considering that. That indicates very strongly that there needs to be people to talk to about these kind of feelings. This statistic is a substance use graph. And so there's 2 here. One is alcohol on the left, and then the right is marijuana. 6th grade, 8th grade, 10th, and 12th are shown. Once again, these are use rates in the past 30 days, self-reported from students in 2023. And while it's good to see that the number is low in 6th grade, the fact that there is a number at all of kids that are reporting in the past month having used alcohol or marijuana is pretty shocking, but good that we're aware of that. Finally, in 12th grade, you see that it's 17% for both, about 1/5 or less of 12th graders reporting that a couple of years ago. That was 23, yeah. Great.
Do we know how those numbers relate to like state or national?
We do.
Are we a little below, a little behind, or?
Yeah, we're a little above.
A little above.
Yep.
Yep.
So, 2023, 10th graders in 2023 reported, 10% reported 30-day marijuana use. I'm sorry, that was in school districts of the same size, 10% reported that.
Yep.
Statewide, 8% reported that they had used marijuana in the last month. So that's 10th graders.
Over 9%.
Yeah, sort of 9%, a little bit over. I think that's across most of the substances that we've looked at. That is pretty consistent, and we're slightly above state averages. Yep. So here's a different way of looking at how kids are doing. These are called co-occurring conditions. And so they call it that because they co-occur with substance use. And so these are things that our interventionists in the school district, actually at the school, are assessing kids with. So kids that have been referred for intervention, treatment, are assessed for these other indicators as well. And so there's 4 bars in each of these: no alcohol use, no marijuana use, and then marijuana use. So in all cases, use is higher than non-use, as reported by the students that were referred for treatment. In the case of anxiety, obviously, that there's something different about that with the reporting of depression and considering suicide. And so once again, this is 10th grade. I think the other thing that's notable for me is that the marijuana use is higher in 2 of those categories than it was than alcohol use. So something about access there. We've definitely seen that since legalization. So that's the kind of information that the coalition initially looked at and continues to look at, those kind of data points about what it is that we can do to help kids and families. And then we boiled it down to 5 goals that we would like to accomplish. And so this is where the coalition began its work in 21 and is still working. The first goal, to reduce community disorganization. And the idea there is that community disorganization is a community that is not aware of what substance use issues exist already and maybe doesn't have a real high level of connectedness in the community, especially within the family, to deal with issues of substance use. That's community disorganization, and so our goal is to decrease that by 5% measure based on our coalition assessment tool. Second goal is to reduce the availability of alcohol, opioids, and other drugs. That happens in a variety of ways. I mentioned that there are ways to affect local policy. That's a great way to try to decrease availability. But I think also perception that kids have that use is normal and I'm going to do it. The community's perception that this is an acceptable behavior. If you can change those kind of perceptions, you can decrease the availability. The community is coming together on this and saying it's not okay. The third goal is more about the changing policy within a town. So perception of community laws and norms that are favorable to substance use. So if families and kids believe that there's no consequence for their using cigarettes, vapes, alcohol, marijuana, then they are more likely to use those substances. That's a perception that Elma Police is very focused on helping kids avoid the use of those things. But there may be a perception that, well, if we go over here, then the police don't care about that. When I first started here, I heard a lot of stories about the logging roads being one of the main places that kids were accessing alcohol. And I think that is one of those perceptions that if it's up there, we're out of the way and people don't mind that. The fourth goal that we're looking at is to reduce the favorable attitudes toward the problem behavior. And so this is also perception. This is the idea that kids think that it's okay. All my friends do this thing, so it must be okay for me to do this thing. That's a norm. That's a norm they've come to in some way, and it's quite often not accurate. A different perception that kids often have, like I said, is that everyone is doing it. And when we survey kids, when we survey families, we find that the amount of kids that are actually using substances is far lower than kids report they believe. And so one of our goals is to change that perception about what is acceptable and what other kids are doing. And then finally, to increase healthy beliefs and clear standards. And I feel like that goes a lot to family dynamics, how parents and caregivers can help their kids understand a path towards a healthy life. And one of the ways to do that is to begin within the family, to make those kind of bonds, create opportunities for kids within the family that will connect them to their family. then here's just sort of a laundry list of the not strategies, but the actual, I would say, things that we are involved in the coalition. The first is to build a coalition. And so that has been an ongoing process, and it's a renewing process. People that, there are some people that are still in the coalition from when I began, and a lot of new folks that were not. And that is the way it is. People cycle in and out of these kind of efforts. So we need to keep this coalition going, and we do that in a few ways. Another strategy is to promote something that the whole country is thinking about twice a year, Prescription Drug Take-Back Day. That national day actually happens in a week and 2 days. On the 25th of April is National Prescription Drug Take-Back Day. And so you may see advertisements, you may hear one of our radio advertisements about it. But in April and October, there's sort of a just national effort to get people to clear up medicine cabinets of things that they no longer need, that are expired, and to get them safely disposed at a pharmacy or a police station, anywhere that there's a safe disposal box, instead of in the trash or in the toilet, which has other negative consequences for the environment. We promote what is called Starts With One, which is an opioid prevention campaign that Washington State created. Washington Friends for Life is a different kind of educational program about fentanyl and naloxone, how to identify and then reverse an overdose. That's a program that we've done a few times here in Elma. We do hold a variety of town hall events. We recently had one at Elma High School that I'll show you some pictures from in a moment. Civic policy review is what I was telling you. That is also school policy review. If we find a school policy that feels like it could be or should be changed to improve kids' outcomes, then we can work on that. The next three are what we call direct services, and these are all parenting programs that we've offered over the last few years. Parenting Wisely is an online parenting workshop, and then Guiding Good Choices and Strengthening Families program are both in-person, multi-session parent and family workshops. And the intent of those is to mainly improve family connection and communication. We do public events in the summer. The coalition hosts a youth activity booth at the Friday market here in Elma. That's the Fridays between when the school year lets out and before it starts up in the fall. And we bring in different folks to offer activities for kids and just have a safe space for kids that are passing through the market with their family. And then finally, a student assistance professional is a very important part of what our coalition allows to have happen in Elma. And I'll tell you more about that in a moment, but that's basically a professional who works in the school in an intervention capacity with kids, students. A little more just about those direct services that you may hear about, and we'd love for people to avail themselves of. Parenting Wisely is one that happens online. And so for folks that can't make it to a class session, they can take this course at no cost from the coalition. And I think about a nine module course. And it's very much about how to navigate problems of communication with the family. So over the last 2 years, 43 families took that course. Guiding Good Choices is one that we've held here at Summit Pacific previously. And in 2025, we did that in Spanish. We had 10 families that were in attendance for that one. Strengthening Families program is a different, similar but different sort of parenting workshop. It's a little bit longer and it involves the kids in the workshop a little bit more than Guiding Good Choices does. They're very similar in the sense that they are intended to improve communication, but especially to have parents bring kids into the family in ways that will give the kids these opportunities to learn new things, to develop new skills, and to get some recognition for that. And it's very specific about that. It's making opportunities for kids to feel more a part of the success of their own family is the intent of those programs. And then once again, Guiding Good Choices is something that we are in talks with right now to have implemented again in the fall in Elma, and that time in English. So these kind of programs happen once or twice a year, and you'll see them advertised around town, and I really hope that people will avail themselves. No cost for these, and I've always attended, and they're really great group experiences. So the coalition that I was talking about, community readiness, and that is a big part of what we do. The idea is to train the people that have said, yes, I want to be part of this coalition, so that they can be really knowledgeable and proactive in prevention in the community, but it's also to train the community generally. So we've done that in a few ways. The coalition members are, one of the perks of being a member is that their attendance is paid for, and even lodging in some cases. We've gone to different prevention summits in Seattle and in Tennessee, and we've had coalition members travel with us to those to learn more about specific substances and also about just this sort of idea of how do you build coalition, how do you build community. So those kind of conferences are something that coalition members can attend. Some of them don't all travel, they're online. There's one next week that's a cannabis education training that's happening online for 2 days, and coalition members are going to be invited to attend that. Community members have come to a lot of the different sort of trainings that we've held, some of them here at Summit, some at the public library, some at the high school, and they are generally about a variety of things, and we time them differently throughout the year. Some of the trainings that we have done have been what is called Talk, They Hear You, and that's very specifically about how to engage with kids around substance use, how to talk to them about it. And there's a program that is called Talk, They Hear You that when we run that one, that is what the night is about. We've done another program called Friends for Life, which is very specifically about opioids, how they work, how to spot an overdose and reverse it with naloxone. We recently held a town hall at the high school that was called Hidden in Plain Sight, and that one had a lot of information about the kind of things that kids may have access to that parents don't know is either drug paraphernalia or an indicator of drug use or mental health condition. And I can show you some more information about that in a moment, but basically we had a presenter who came and set up a mock teenager's bedroom and invited people to tour it. And then they talked about all of the things that they found inside this mock bedroom. And then finally, youth have also attended different trainings. One of the ways that we've engaged with youth is in this policy change work. Different coalitions have found that when kids are the messengers of this kind of, we need to change in our community, the adults and city councils are very receptive to that. And so we've jumped on them and worked with kids. Yes. Yes. So we worked with kids that were interested in making policy change happen in Elma. Two really notable projects. One was the Parks project about the amount of smoking and vaping that's happening near playgrounds. And then the other project that's happening currently is kids are making a presentation to the Grace Harbor Board of Health about the environmental costs of vape waste. And in addition to that, kids have attended trainings on how to refuse when kids are offering them drugs or encouraging risky behavior, driving safety for themselves or traveling with their peers, and also just some information, substance-specific information. It's better that kids get real information from people that know instead of just wherever they find it. And so all of that is intended to basically build that community's capacity to respond. So we do public-facing events too. This one is an example of what's called a positive, what do you call this? Just a sort of positive activity, a way for kids to have positive activities in the community. I think a lot of folks know that in this area there are not a lot of outside of school activities for kids to do, but there's a wonderful market that happens every Friday. And so the coalition has hosted a youth activity table there for the last 3 summers, and we're intending to do it again this summer. If anyone is interested in being part of that, we're always looking for folks that can offer their the kind of crafts that they know about to help teach kids. So So it is a volunteer-run activity booth. I think on this day, looks like we had about 8 kids doing different activities. And so we set up a tent for inclement weather, and then to the right, you can sort of see that the market is happening too. We've been a part of Elma Halloween Fall Festival, which is a great place to be. Another just positive activity for kids and families. I love that the streets get closed down. Here's the town hall that happened recently at Elma High School. And so this is an example. This one was intended for 2 different audiences. So we invited families, and especially families of older students, because we wanted to do a presentation for parents and a presentation for youth. So at the same time that parents were attending Hidden in Plain Sight, where they were learning about indicators of substance use, youth were with a representative from the Grace Harbor Target Zero, which is all about traffic safety and sober driving. And the kids were encouraged to think about safe driving and refusal skills, especially how they can keep themselves safe if they're being pressured, either to ride along with someone or that has used something, or to take a substance. And so you see a little bit of that happen in there. It's really well attended. I think we had about 50 people in attendance that night. Or better attended events. Yeah.
Hey, so I attended Hidden in Plain Sight at this event.
Yeah.
And I'm just here to say, an eye-opener.
Yeah.
Right? And mind you, my children are mid-20s and 30 years old. And, you know, and I've been around drugs and alcohol, and, you know, family members and all that. Like, the simulation was amazing. I think there was 50 or 60 paraphernalia spots, and I probably picked half of them. But not the other half. And then the presentation information was amazing. I mean, this is like regional presenters coming from across the state. And, you know, hopefully if you do this again, like, please, anything that we can do, I think, is summit to help encourage students and parents to come, because this was outstanding, like best in class, great educational information that we all as parents, you know, especially if we have parents that are middle school or high schoolers, even elementary schools, like, you know, get there, make the time. So,
absolutely. Yeah, this one wasn't intended for kids to attend, and so that was the little bit tricky part of that.
Yeah.
I want to give kids ideas about how to conceal things.
right.
But it's really important for the parents to see that, and then to go home and have those conversations with the kids, which we encourage them to do at the conclusion of that. Yeah, so that's an example of what our coalition can do. We have funding to bring presenters in. The person who did Hidden in Plain Sight was from the eastern side of the state, and so she traveled out here to do this presentation for us. That's a lot of how our coalition works, is we ask what kind of trainings would you like to bring, and then we go out and find people. So once again, prescription drug safety is very important for community safety, and there's 2 ways to accomplish that. One is by getting rid of things that are expired or unneeded, and then the other is to keep things that are needed locked up. And so the coalition approaches both of those, especially at this time of year when it's National Drug Take Back Day in a week. But we do keep medication lockboxes available to the community year-round, and so if that's something that you feel like you're needing, you're always welcome to contact me or the coalition, and we can get you a free medication lockbox. To the right there is a sign. We put those kind of signs out during prescription drug take back just to alert people that all of the pharmacies in our area have medication drop boxes that people can drop things off for cost. And the police station does as well, in McCleary and Elma. So it's good just to remind that those boxes are out there. They are very local. It's very easy to get to. For folks that it's a challenge to travel, there are ways to get disposal supplies sent to you from a website called medtakebackwashington.org. So that's a way, just if someone wasn't able to travel and use a Dropbox, they could get a mail-in envelope sent to them from Take Back Washington.
Steve, I got a question.
Yeah.
So the drug give back.
Yeah.
Do we have a date on that? Is that this Saturday or the next?
You know, the national day is the 25th, and we are doing a radio promotion this time. And the reason we're doing that is because we are going to table at the Little League opener this Saturday. So we're kind of considering that our in-person. We'll have medication lockboxes, but we'll not be doing a medication drop-off.
I've had a bunch of people ask me, and I didn't want to give them a date until I knew for sure.
Yeah,
So medications can get dropped off on the 25th?
absolutely, and that's, or at any time at any of the medication drop-boxes in town.
Okay, and on the 25th, what
Yeah.
time and where?
The 25th, really, that's not an event.
Okay.
Yeah,
But this Saturday is.
this Saturday is.
This Saturday is
Yes.
that still at the church?
No, so we're gonna go where the people are, so the Little League season opener is
At the
happening
Little League.
at 10th Street Park, yeah. So, we'll have a coalition table set up there. We will have medication boxes there, I'll have other information to give out, but we won't be doing in-person medication collection. Since it's at our, it's Little League event, I didn't want to add that to what they're doing. So it's more informational, just to sort of send.
So they're not dropping off
Not
meds?
gonna drop off there.
Okay, do we have a date for that, or just drop them off at the
Yeah.
location?
Just drop them off at the places in town.
Okay,
So, all three of the Rite Aid pharmacies here at Summit, downtown Ottawa, and then in Cleary next to the Summit there. And,
we don't currently have a box, is that something we want to look to do for the police station?
we did, there was at the old station, and did it not move over?
It didn't, so maybe we should need to move the old box over?
Yes.
Okay,
Oh, I did not, yeah.
unless they did it, I didn't see it,
Okay, I didn't either.
I'll check on that.
Okay.
And I did my radio bit, so hopefully that sounds,
Oh, that's great.
we'll see.
Thank you for recording that, Chief. That's really awesome. So yeah, over the last few years, we have done some in-person drug take-back events, but this particular time, we're just doing an informational one. But if you are interested in getting a medication lockbox, please come out to 10th Street Park. We will be there between 9 and 11 on Saturday, the 17th of April.
I'll be at concessions.
Oh, you will? Right. That's where we'll be.
Hey, just clarification, it's,
Yes.
East County Health Mart Pharmacy.
Yes.
At their 3 locations.
Yep.
Okay, with, 2 here in Elma, 1 in Cleary.
Yeah.
Great, love it.
And in McCleary, it's right next to, that's a Summit facility.
Yes.
Yeah.
Yeah.
Just on the main street there. Right, 3 pharmacies in our area. Yep. So here is an example of a project that the coalition did. This is what we would call a civic policy change project, environmental strategy. And the messengers of this were once again kids. So we have kids that are in PAC 4014 that had been doing town cleanup and especially park cleanup. And they were coming across so much cigarette and vape waste in their park, around the playground, on top of the dugout, really all around. And they recognized that there was no signage in the park at all, saying that it was, well, there was a very worn out wooden sign that had a cigarette with a line through it, but nothing any more explicit. And so they had an idea to go to the city and ask for the city to make a new policy that would make it either like increase a penalty for people that are smoking and vaping in the park, or create some kind of policy, or at least to recognize that there are kids in the town that are concerned about this and allow us to do something like make these signs. And so that was where the city went. In the center, the city wrote a proclamation just recognizing the kids' message and empowering the coalition to create signs. And so since then, these 2 signs have been up at the 10th Street Park in a couple of different locations next to the concessions and also next to the playground. And I want to believe that they've had some positive impact. It's really good to remind adults that they are around the kids and that for reasons that they may not think, it's good to just avoid doing that activity. It sort of changes kids' perception when they do not see people smoking and vaping. Oh, I guess it's okay not to. And that was the kids' idea for a slogan at the bottom there, Elma's Youth, Our Future. So that's a project that we did a couple of years ago, and those signs are still up in the park. But there's a project that has been getting worked on with Elma Middle School students during this last year. And there are kids that are in Elma Middle School Prevention Club, and their goal has been all year, they've been making signs around their school to encourage their peers not to smoke and vape or use other substances. But we had this idea that there's a different message, that vapes are called disposable, but they actually are not. If you throw them in the trash, it's a hunk of plastic with a battery and some toxic nicotine juice, and it goes into a landfill, and in some cases they can combust, and in some cases they can leak into soil, and in a lot of cases they just get strewn around and not disposed of properly. That's a big problem that there isn't a real clear solution for. The nearest place that a person could take a vape to dispose of it appropriately is in Puyallup, where they have an incinerator. So not too many people are going to drive that far from Grace Harbor to do that. And so kids in the Elma Middle School Prevention Club wanted to make a presentation. And we thought about, well, who is that to? Should it be to the city? And then we decided it was going to be to the Board of Health. And so tomorrow morning, Middle School Prevention Club kids are going to be on for a 10-minute presentation about the need for Grace Harbor to create some kind of disposal solution. And so they've been working on a presentation that will be happening tomorrow morning at about 9. So the work that most of what I've been talking about has been, with the exception of what I just said about the prevention, but most of that has been outside of the school. A really important part of what the coalition is about is being able to fund an preventionist who works inside the school. And so we've had someone who has been on staff with ESD 113 at Elma Middle and High School for the last few years because we've had a coalition going. And their role is student assistant professional. The focus of their work is to do what is called universal school-wide prevention. So they're doing presentations to large groups of kids. And then to do smaller, sort of more focused work when that's needed. And so that is screening and referral for behavioral health conditions. Kids are referred to our student assistant professional if they have been caught vaping or using a substance, or if there's just sort of rumor, or if they are self-reporting that they're having a problem, not being able to stop using something. And so our student assistance professional is there to have direct intervention with them, but also to lead groups like a prevention team that does a lot of other work to sort of encourage their peers to better behavior. And then finally, they're able to, from that setting, they can refer to outpatient, but that's not what happens at the school. Obviously, the school is just sort of an intermediary and a place for kids to have some constructive change instead of a totally punitive consequence for behavior. So that's, like I said, been happening in the middle and high school. We've also had a school-based health center that's been in operation for the last couple of years. It is not funded via the coalition, but it's related. And so I'll just mention that it's out there. The school-based health center is still in Elma Middle, elementary, middle, and high school, providing dental, vision, screenings, other services. But the main work of prevention is happening with Ursula Swanson, who's at the middle and high school. And I think she has about 25 kids in her prevention club and about 50 kids that she sees for different services. So lots of kids availing themselves of the student assistance professional. So here's just a little bit of sort of statewide, or I'm sorry, this is not statewide, this is the ESD 113 True North program, which is what Ursula works within True North, and how successful it's been. And so here's some stats for use rates that changed between 21 and 22. Alcohol rates before and after, binge drinking rates before and after, and marijuana use rates, once again, that's 30-day marijuana use rates before and after, all showing pretty significant reductions for those kids that came into the True North program. So I think some real success there, the biggest being with the binge drinking reduction. Awesome. Another way to sort of identify if the program that we're running in the school is successful is if they're having other behavior-related issues. So between 21 and 22, some reductions in getting in trouble at school, being suspended from school, or being in a fight at school. All of those showing pretty good reductions too. This is showing student perceptions about how they think that they are doing, and it's like a hopefulness gauge, before and after. And students saying that on the top column, I think I'm doing pretty well, saw a 21% increase. I'm doing just as well as other kids, 26% increase. Even when I want to quit, I know I can find ways to solve the problem, saw a 25% increase. So also pretty significant, at least a quarter of the kids that have gone into the True North program have reported some significant increase in their hopefulness, their ability to deal with stress. Then their student perceptions about their interaction with True North and the student assistance professional. Has it been important? 47% said somewhat important, 48% very important, and only 5% said not at all or not very important. So what is that? Most kids, that's 95% of kids, felt that it was an important experience for them. So those are ways that the True North program has evaluated its progress. And then one of the ways that our coalition evaluates what we are doing and also the status of the community now is to do a community survey every other year. And that is currently happening. So I just would love to encourage anyone to scan that code and take a 5-minute anonymous survey when you have a chance. We'll ask you questions about what do you think are the biggest problems that kids are facing in town. Yeah, it's essentially that. It's like, what do you think as an adult kids are needing, and what are you hearing? Finally, I will just let you know that our coalition meetings happen once a month. That is a really great way to find out more about what the coalition does and meet other people. One of the things I've learned about the coalition since I started is that it is a great interconnector, and it connects a lot of people from a lot of partner agencies, a lot of the folks that are doing all of the good work in the Grays Harbor area, and especially in Elma McCleary, come to our meetings. And so those kind of connections lead to more projects birthing. So I feel like if you are a person who would like to see good things happen in Elma and McCleary, a coalition meeting like this is a place to go and meet those people and make those connections. So we always hold them on the last Friday of the month from noon to 1, and it happens where the school board, Elma School Board meets at the Transportation Department meeting room. There is our email address again, elevateeastcounty@esd113.org, where you can look for us on Facebook, and there'll be information about our meetings there as well. I believe that is it. Thank you all for your time and attention. Happy to answer any questions if you have. Anything coming, Ryan?
Everything's great.
Okay.